you all for coming today. My name is Mark Winkler. I'm the EMS for Children Program Manager at Maine EMS. And we're here to talk today a little bit about some projects that we're undertaking for pediatric care in the state of Maine. Obviously, we're in a state of COVID. We're not wearing masks because we're outside, sort of with bay doors open. If anyone needs to go past those doors, please make sure you have a mask on. Otherwise, out here, you're okay, your preference if you're vaccinated. So with me today are Jim Lapola, the Director of Wells EMS, and Charity Neal, the Chief Nursing Officer at York Hospital. We also have some other nice guests in the background that are going to be available for questions afterwards. So the Maine EMS for Children program is a federally grant-funded program that is designed to improve pediatric care, education, and preparedness across the state of Maine. If we look at the state as a whole, about 5% of the calls for EMS happen that involve pediatric patients. And that number is important for two reasons. One is every one of those percentage points is a child and a family who's having a bad day. No one calls EMS, no one goes to the ER because they're having a great day. So it's important to remember that as we go through that we're keeping children and family in mind through all this. The other reason that it's important is that it's a remarkably low number. 5% is not really statistically great. However, when someone calls for a pediatric patient that's in distress, we have to be on our A game. We can't get a do-over, and we need to improve that so that we're always giving the best care that we can. The challenge with it is that we don't see a lot of kids, so we don't get a lot of experience with that. There are places in Maine that are very rural that don't get exposed to pediatric patients very often, but even in a more urban setting, we find that both EMS and emergency departments don't see as many kids as experience would want us to do. So when we think about adults, I can easily simulate a middle-aged man having chest pain. I could have a physician, I could have an EMT come, and I could simulate that, I could answer their questions. But we can't ask a 9-month-old to simulate being unconscious or breathe really fast. And so what we've been faced with in the past is using either your imagination to pretend or using plastic mannequins that are great for skills like taking blood pressure or starting an IV, but they can't respond and give us that presentation that challenges us and makes us make clinical decisions appropriate for the patient. That's changed. What we've partnered with is health scholars to use their Pediatric Emergency Assessment program. And we use this through a virtual reality device, an Oculus headset. So if you think about this is essentially a smartphone, and we're running an app. That emergency assessment, the pediatric emergency assessment, is that app within this program. And what this does is immerse the student in a pediatric patient's situation. It simulates let me pause for a second, sorry.
It's a pediatric call.
Business goes on. So as I was saying, when a user utilizes this, and this and a handset are the tools that a learner would need. And this is portable, can be used wherever you are, it can be used anytime, day or night, and it's independent learning. And within this, you're immersed in a no-risk situation where you look at a kid, you see their presentation, you see what they're doing, and then make clinical decisions based on the presentation. So you're seeing and you're hearing that exposure to the pediatric patient. So we gain experience without risking it, and we can do this across the state. Now we're lucky enough that we partnered with Wells EMS, Bath Fire and Rescue, Rockland Fire and EMS, and York Hospital. So we're going to do this in-depth review with them. Essentially every quarter we're going to go and work with their clinicians and bring this device to them, and we'll see over time how they improve with their pediatric assessment skills, and if we have gaps in that knowledge so we can direct training to fill those in. We're also going to make this available to departments across the state and emergency departments across the state on a more limited basis. So we'll come in, do a one-time training with that organization, and they can gain that knowledge and assessment from it. So this is hopefully a long-term project that we can continue to improve pediatric care, and where we have that gap in experience, we can make up for with education that's realistic and no risk. So without further ado, Director Lapola, if you want to say a few words.
Sure. I'm gonna be much shorter.
Can you get rid of
Yes, ma'am.
Sorry.
I'm gonna be much shorter. Welcome to Wells. Welcome to Wells EMS. If you had told me 10 years ago that we were gonna be using virtual reality and a headset like this for education for paramedics and EMTs, I would have given you an eye roll. If you told me 5 years ago, I probably would have given you an eye roll too. But this is innovative. This is realistic. This is easy. Even an older provider like myself can use this and be successful with it. So thank you to Mark and the Maine EMS for Children program for bringing this innovation technology to Maine. Thank you to Health Scholars for coming here today and giving us all this technology to use. Our partners at York Hospital, which we couldn't do any of this without them. So thank you again for coming to Wells.
Thank you, Derek. Charity?
Yeah, so at York Hospital, we have the same numbers. We see a very limited number of pediatric patients as well, and a lot of those that come to us come by ambulance and some don't. So we need to make sure our providers are as prepared to take care of these kiddos as the EMTs who join us. And we know these guys are our partners. I tell you, you want to see a teamwork, you see a critical kiddo come into an ER and you'll see EMS and ER staff work together hand in hand to make sure we're all providing that. So if we can train together, we can work together. So these are low volume, high risk situations for all of our staff. Our nurse manager, Wendy, has reached out to our family care staff in our hospital who are also going to take advantage of this great opportunity. Like Mike and Jim said, there are very few parents who will sign their infant up to let EMTs play with them. There's a few out there, usually EMTs. But we will, this is gonna be great for us to have these opportunities, and we look forward to working together more and more with EMS. We're co-located, we might as well do everything we can.
Thank you. So, again, thank you to York Hospital and to Wells EMS for hosting us today. This is a unique opportunity. I'm excited. Maine is the first state in the country to do this statewide. There are pockets of doing this, and there are certainly lots of organizations that are doing this cross country, but no one's undertaking a statewide initiative this way. So, unique to Maine, and we're kind of leading the way with that. So, I'm happy to take any questions that you might have. We're also available for questions afterwards. We have all our devices set up for you to take a look at. You can try it out. You don't have to be medically trained to do it. You can experience that and talk to the folks that are going to be using it. We're also simulcasting it on the monitor that's over there. So if someone's doing the scenarios, you can watch what's going on as they see it. It'll be less immersive because it's 2D instead of 3D. But I would encourage you, take a minute and look at this. It's really impressive stuff. So, is there anything I can answer right now, or would you just like to see the devices and take a gander?
We'll see.
Yeah.
All right.